Hi, I'm really honored to be here today. Like some of you here, I'm a mother. Every day when I wake up, my day is very much determined by the health of my kids. I am the chief medical officer of my family. And like those of us in Vancouver, or frankly in any country around the world, we share that role. But in some places, the reality is, it can be a pretty tough job. I lead a team at Pfizer called Global Health Partnerships. We work with partners like Gavi, the Vaccine Alliance, the Bill and Melinda Gates Foundation, the Children's Investment Fund Foundation, and others to make sure there's sustainable access for our medicines and vaccines in the world's underserved populations. We do this through creative market access solutions, where we look at the needs of the local communities, and then we bring together, not just Pfizer, but our partners, our resources and our expertise to help address their needs. We work with our partners to understand what's the burden of disease. What does our manufacturing capacity need to look like in order to support that burden of disease? And establishing the lowest global prices for the underserved populations around the world. You might be familiar with a product called Cyanopress. It's a self-administered contraceptive, and it allows women around the world to decide when, if, and how many children they have. Since 2014, we've proudly partnered with the Gates Foundation and the Children's Investment Fund Foundation to bring this technology to women in underserved communities for 85 cents a dose. I'm happy to share nearly 20 million women have accessed the product. And you can imagine what kind of impact that has, not just on the woman, but on the entire community. But women aren't just playing the role as chief medical officers for themselves. They're also doing it for their babies during their most vulnerable years. And the way that Pfizer supports that is through our partnership with Gavi, the Vaccine Alliance. We bring our pneumococcal vaccine to children in the poorest countries around the world. 1 out of every 2 doses we distribute of our vaccine actually goes to one of the 50 Gavi-eligible countries that we currently reach with our vaccine. This gets us really excited because, sadly, pneumonia is still one of the leading causes of death in children under 5. However, since 2010, we've distributed nearly 400 million doses of the vaccine, reaching children in many countries across the underserved populations. But we don't just look at vaccines or at family planning products, but we really try to understand what are the local realities on the ground. We take those learnings on what the challenges are locally, and we make investments to help address those challenges. One way that we do that is actually through the creation of our multi-dose vial of our pneumococcal vaccine. Vaccines require refrigeration, but in some countries, there's pretty limited refrigerator space. So we developed a multi-dose vial of our vaccine that has 4 doses in the same vial that just had 1 before. Now it uses less fridge space. In addition, we know that 25% of the global disease burden is in sub-Saharan Africa, yet they only have 3% of the healthcare workers. That means training is really critical. Together with WHO and our partners, we created a train-the-trainer model where we could educate healthcare workers on how to use the multi-dose vial so they could get the most out of it, and at the same time start with a small group of healthcare workers and then expand that knowledge out to the most remote villages. I'm really happy to say we've actually trained so far more than 40,000 healthcare workers in 24 countries. In addition, we're really excited about the science that's on the horizon. The next scientific breakthrough that we're focused on is maternal immunization. Being able to vaccinate a pregnant woman so that she can pass along much-needed protection to her baby in the early days of their lives is what's getting us excited. Protecting against diseases like Group B streptococcus that can be potentially fatal. Women, like me, when I was pregnant, who find out that they're Group B strep positive, can sometimes, depending on what country they live in, receive antibiotics during labor to prevent transmission to the baby. But that's not the reality in all countries. That's why the potential for maternal immunization has us so excited. But I don't have to convince many of you in this room about the importance of women, no matter where they live, having access to the technology and tools they need to help keep themselves healthy and their families healthy. Whether it's a woman in Laos bringing her baby to get immunized, or a woman in Tanzania looking at family planning options, we together can help make sure that the health clinics that they visit, in what are usually those long journeys to get there, are fully stocked with high quality, safe, and effective medicines and vaccines. Because after all, there's little ones waiting on us, like my daughter here, Nadine, who's counting on me to be her chief medical officer each and every day. Thank you.
Thank you. Thank you, Lindsey. That was lovely. Your daughter's so cute.
Thank you.
Would you like to tell us how old she is?
So that is actually during her first immunization visit when she was very young, but now she's 3.
3. That's okay.
I just love that one because she looks, so vulnerable, like what we're all trying to do, which is protect the little ones and ourselves to stay healthy.
Thank you. So the question of the week, please tell the audience, tell us, how will you continue to use your power for change?
Yeah, I think the way I want to continue to use my power for change is to give a voice to the people that aren't here at the conference with us, but that really need to rely on all of us coming together, and me coming from the private sector, playing a strong role, advocating to continue to play a strong role, and I think also giving some visibility to partners that might not have worked with the private sector before, that we're here to learn, we're here to partner, because together we're going to have the best shot at creating equality.
Thank you. Please, another round of applause.
Thank you.